Welcome to the Nursing and Midwifery Annual Achievement Awards for 2018. This year we have had a significant number of entries for these highly prestigious awards for the category of practice improvement or research and audit. You may not be aware, but each year the prize money is kindly provided by the charitable trustees to promote ongoing practice innovation and nursing research. The standard of entry was very high and received from all areas of nursing practice in both community and hospital settings. 6 individuals or teams were shortlisted and presented their work to a judging panel which comprised of Liz Harris, Deputy Director of Nursing, Professor Pauline Pearson at Northumbria University, and myself, Elaine Coghill, as the Trust Lead for Nursing and Midwifery Allied Health Professionals, Research, Education and Practice Development. The individuals or teams were then videoed so you could learn more about their work and find out about their projects, where their ideas came from, what they did and the difference it has made to patient care. We hope you enjoy these and see what a fantastic difference they have made to patient care.
The Butterfly Project identified experiences of families following the loss of a baby from a multiple pregnancy. I can't imagine how difficult it must be for families to lose a baby on the unit and then have to walk back into that unit the next day, facing the same staff that they saw the day before, and visiting their baby that's surviving, and having the complex emotions of being really sad and desperate that they've had this loss, but also happy that they've got a baby that's alive and well. Parents told us that they found it really difficult coming back into the unit and retelling their story, and they felt they shouldn't have to retell their story time and time again to health professionals. So this is why we developed the Butterfly Cot Card, and that was a way to have a visual stimulus for all members of health professionals, so the moment they walk in the room they know that that baby has been a twin or a triplet.
So these are the Butterfly Cot Cards that were developed through the parents' experiences, and these either go on the cot with the baby or at the cot side. So the twin that's died, the name is written on the cot card under here in this space, and it remains next to the surviving twin, so we're aware of the twin's name. We also have the butterfly stickers, which kind of go through antenatally as well if there's been a loss in pregnancy, and they stay in the notes, and we can also put them in the notes as well once they get onto our unit. So then all health professionals that come onto the unit and read the notes, it is identifiable from doctors to health cares to ward clerks, nursing staff, nursery nurses.
We decided to expand a little bit on the project and develop further for more for siblings. So we decided on the pin badges that we've got here, and this is for siblings where they can wear it on their coats or on a teddy, and then it's recognition of a triplet or a twin loss. So we're wanting to develop further as well with our mini boos that we have on the unit. So every baby on the unit has a mini boo. But with the Butterfly project, what we wanted to do is add the Butterfly logo on. So it goes inside the cot or the incubator with the baby, and then it's recognition. The staff nurses or anyone that's looking after the baby or doctors or anything can see this and recognise that they are a twin or a triplet loss.
So we've been really overwhelmed by the feedback that we've got from these families as a result of this project. It's allowed us to kind of have a real better understanding of what these families are going through, and has brought the families together as a family unit. We've had families that have recently lost a baby just before Christmas, and the eldest sister was a real part of the process, and she was involved in the funeral, and actually at the graveside we had flowers that were in the shapes of butterflies. So it really just kind of underpins how successful this project has been for these families and the real impact it's had on them. And the research has been really successful, and we've actually now, it's been established worldwide, and recently Sarah and I have presented the project in Vienna.
I'm Heather Williams, nurse consultant for chronic pain management.
And I'm Marie Walker, a specialist in the chronic pain management service.
And we're here today because we've been shortlisted for the Nursing Achievement Award, and the project that we've worked on is a team project. We've worked with the Chronic Pain Management Service, doctors, nurses and the pain management programme team, which has psychologists, physiotherapists, and we've developed a patient education film to try and help and support patients to better understand chronic pain. The idea came about because we were looking for good standard educational material for patients to try and enhance their care, and it appeared that there wasn't a great deal of this. We were using an Open University DVD, which was quite dated. So having looked at all the literature and the products that were available, we decided to try and produce our own educational material for patients. And the idea behind that is it supports patients to make more informed choices about their pain management, and it also hopefully will make the quality of the consultations with patients in the chronic pain management service that much richer, and it will give patients more equal partnership with the medical and nursing team when we're having consultations. We were also hopeful that it would change the way that the pain service delivers its care by inviting patients to the education classes to find out more about chronic pain, how it can be managed.
We also intend to disseminate this information out to the wider population, for example in GP practices and to other services, so patients and other healthcare professionals are more well informed before they actually come to the appointments, and the appointments are more appropriate to the patient's needs.
I think it can have a massive influence on how the service is delivered. We've already come up with a pathway that's been agreed by the rest of the team. That's the pain management programme team and the chronic pain management service, where patients will now be invited to attend the patient education group class where we'll use the patient film that we've developed. The film was developed with funding from industry, so it's been zero cost to the NHS, and it's taken about 2 years to actually get to where we're at now. And as I say, it's a number of people that have been involved in it, from filmmakers to psychologists, physios, nurses and medical staff.
We'd hope to further develop this project by the development of a booklet that would accompany the DVD to support the patients, so when they could go home after an appointment they could reflect on the information they've been given, and again allow them to make a more informed choice and informed decision making.
We are the 0 to 19 health visiting and school nursing service, working with Eastern European families. Many of the families are from the Roma community and have suffered persecution in their home countries, and as a result have a mistrust of services and struggle to access services including healthcare. The women's group based at the Migrant Project told us they would like some resources in their language, and specifically explaining the role of the health visitor and school nurse, as many families think that we are social workers and are afraid that we will remove their children. This special partnership with a voluntary sector organisation who has established relationships of trust with this community has allowed us to build meaningful reciprocal relationships and created a safe place to share through listening to the women's views, fears and needs. The project is led by the women who have a sense of ownership over the project, and therefore it is an empowering approach which supports families to feel a valued part of the community.
I am Gabi and I am part of the women's group. I feel important and appreciate to be part of this group. I am Petronella and I feel more confident explaining to members of our community what a health visitor and a school nurse do.
This project has had a huge impact on our practice and our understanding. We've spent time unpicking deep-rooted beliefs and fears that hadn't previously been realised. We've found talking about confidentiality and safeguarding has been a massive challenge. People have been very fearful about this, and it's taken considerable discussion and support to find a way to express this within the leaflet so that everyone's happy with what we've got.
We hope that we have taken a small step forward in building trust and breaking down barriers with our families. Through supporting understanding of our service and how to access it, we hope health and well-being will be improved and fewer resources will be wasted, inequalities will reduce. This approach can be replicated across the Trust in other areas, and we hope if our resources are evaluated to be effective, they could be shared across the country.
project that we've been dealing with has been about our count procedure, because in 2012 and 2013 there was an increase in never events in theatres over the trust, and we had to look at our policies and had to do reviews and have a look at all the things that we were doing to improve patient safety in theatres.
After we found we had the never events, we started quite a detailed piece of work that's been going on for 4 years now, and we've reviewed practice, we've looked at the way the count procedure's done, and initially at the beginning the operating theatres worked in independent ways, and cardio worked on their own, and theatres and women's services. We've drawn all the services together. We've rationalised the count procedure, we've changed the way that we do our count sheets, massively reviewed the count procedure policy, and we audit now on a regular basis. We've got all of the staff have ENTT competence, they have account competency that they do. We've got robust methods in place for sort of protecting the patient, and significantly drawn practice together for the count. And we've involved the medical team during the process, because the count sheets have a section where the surgeon has to sign to acknowledge that they've been told that the count status is either correct or incorrect, taking all of the policies and any changes through the theatre user group. And we've developed really robust ways of working, and we've forged very positive relationships. So now that all the theatres have consistency in the way that we do the count.
So moving forward, what we would like to do is develop the multidisciplinary team members, which we have within the theatre when we're doing the counts. This is building on what we've already implemented with the policies and the count procedures that we've embedded hopefully in practice now. We have joined up study days now, which all new members of staff attend, which improves again the communication between the different team members. Simulation is another way of training staff to develop their skills. Human factors is also another thing that plays a large part within the theatres, how they can improve the patient safety within the theatre.
As a critical care nurse, I am continually exposed to damaging effects of sepsis. Sepsis presents a challenge for all healthcare professionals. This is a time-critical condition that can be difficult to recognize due to its variable clinical presentation that can be easily missed upon assessment. The challenge is if nurses are not aware of early signs and symptoms of sepsis, that can delay recognition and treatment. Sepsis can progress to organ failure, and that reduces chances for patient survival. So what we did in collaboration with clinical lead for sepsis in our trust, Dr. Ben Messer, we have conducted pre- and post-educational survey where we have assessed nurses' knowledge of sepsis, provided education for them, and evaluated effectiveness of our teaching strategy. When we have assessed nurses' knowledge of sepsis, we found out that there is a need for improvement. Therefore, we have implemented our teaching strategy, which was directly delivered in clinical area, where nurses had a unique opportunity to reflect on their clinical practice. When we've evaluated the effectiveness of our teaching strategy, we found improvement in nurses' knowledge of sepsis. Most importantly, we improved nurses' understanding of evidence-based guidelines, such as screening tool red flag sepsis, designed to improve early recognition of sepsis, and Sepsis 6 care bundle that evidence shows that when delivered within 1 hour of diagnosis, that can reduce the risk of mortality by 46.6%. In addition, our project helped to develop a culture of sepsis awareness on our unit, which is evident from ongoing discussions with nurses about their experience while caring for septic patients. Also, I was invited to share my work in other departments with the practitioner, which has given me opportunity to raise awareness about sepsis trust-wide.
Newcastle Eye Centre is one of the busiest departments in the UK. We've seen about 120,000 patients per year. We do 9,000 cataract surgery per year, and I've seen about 3,300 patients between 2015 and 2016, and I've noticed the complication rates about 3.7%. I felt that we may not have to see some of those patients in a clinical environment. I explained this to my manager and the responsible consultants in the department, and we expressed that we may not have to see some of those patients in a hospital and clinical setting. Then we have created a guidelines and protocol, and we looked at about 100 patients as a pilot. Those 100 patients, we have received about 85% of letter that come back to us and mention that they were very happy with the result of their cataract surgeries. And so our main aim was, how can we continue measuring our success in terms of safe, effective and quality care delivery? And 85% of outcome were absolutely fantastic. 15% of the patients that we haven't received the letter from back and we phoned them up again, they were still happy that with the result of their surgery. So we have made those 100 patients, we have made a phone call to each of those patients. We have saved 600 slots, within 4 months since January this year, and we expect to expand this 2,200 slots by end of this year. And most of our patients as a Newcastle NHS Trust, we are covering very big wide area, and we expect that these numbers are increased over the coming years. And also we have reduced our waiting times. Those patients, about 32% of the cataract patients who had cataract surgery done, we expect them not to be seen in a hospital environment following their cataract surgeries. By doing this, we're going to reduce the waiting. We already have actually, we reduced our waiting times. And also we have transferred one of our nurse specialists from post-op cataract review to the other eye specialities, and also receiving fantastic and positive feedback from the patient was very, very important.